This afternoon, you'll hear some brief remarks from the people who helped make this exhibition possible. From the curatorial team here at MOV, a long hauler and member of the exhibitions team, representatives from the post-COVID interdisciplinary clinical care network, and our partners at Simon Fraser University's Faculty of Health Sciences. Their words will help set the stage for what we're going to see in the gallery today. And I would really like to thank everyone who was involved, because part of our role at MOV is not just hosting historical exhibits, talking about things that have happened. It's helping to make sense of the world that we live in today. And this is a really important conversation that needs to happen. Because as you'll learn in our exhibition, 1 in 9 Canadians currently have long COVID symptoms. And if we don't help provide folks with a platform, then I think that our chance of building a better, safer future is that much more limited. On behalf of MOV, I would like to sincerely thank our partners, Simon Fraser University's Faculty of Health Sciences, the Post-COVID Interdisciplinary Clinical Care Network, our funders, the Pacific Public Health Foundation, and the Michael Smith Health Research BC. But most importantly, I would like to thank the hundreds of long haulers who opened up their lives and experiences to all of us. This project is such an important reminder of why museums matter, and a critical, important reminder that the COVID-19 pandemic is far from over. All right, so I'd like to welcome our first speaker to the stage, and that's Dr. Vivian Gosselin. Please welcome, Vivian.
Bonjour, hello everyone. Thank you so much for coming to this opening. It's very important. It's been a real honor to be the curatorial lead for this project. Thanks to the SFU partners, I think the vision was clear from the get-go. Making visible the invisible. So the day-to-day realities of people living with long COVID. And from, again, the get-go, like there was this aspiration to create a space that's open, that's full of light and color. And what it is the topic is difficult, but when you look at the stories, it's about resilience, adaptation, about courage, and about solidarity and hope. The design and colors are meant to carry this spirit forward. This project was only made possible really because 46 long haulers decided to share with the rest of the world their day-to-day life, through words and images. And so we're so thankful and I know many of you are here. So thank you, and we are full of admiration. I'm deeply grateful to our SFU partners who were able to see I would call it the regenerative power of museums. So the ability for the museum to not only inform, but to spark reflection, compassion, and action in the public sphere. We really think that the role of museums is not just about talking it and interpreting the past, but really to carry conversations forward and to, in so many ways, uplift the voice of marginalized groups. We believe that our role is to provide that kind of platform for dialogue, for recognition, and for care. I'd like to thank my close partners. They're in the room at SFU, so Dr. Rakib Tesfaye, Dr. Haley Byers, Haley Jemison, Ryan Hare, and Glenn Speed. At PCICCN, and so PCICCN, for those who don't know, is Post-COVID Interdisciplinary Clinical Care Network. And we have, so the team was really of these two groups. So Esther Kaur, Dr. Yet, Dr. Adira Levin, and Alia Izquierdo. And we have members of the advisory committee, Catherine Baldwin, Kathy McLean, and Robert DeRosa. So it takes a village to produce an exhibition. So we have colleagues in all the departments here at the Museum of Vancouver: fabrication, design, communications, public programming. So they've all been critical at making this exhibition happen and activating it also once it's open. A huge thanks to Mia Hansen, who did the lion's share really of the graphics. You'll see it's a lot of graphics imagery, and you have to create a space that's welcoming and inviting, and she's done it. So lastly, our hope is that when people go through the exhibition, we hope that visitors will listen deeply, reflect, and carry the stories forwards. It's not just about COVID, really, isn't it? It's really about how we care for one another. So let's carry those stories forward. Thank you so much, everyone. And so I would now like to invite Dr. Adira Levin, provincial lead with PCICCN. Thank you.
So thank you very much for allowing me to talk, and it's really a privilege and an honor to be able to stand here today. PCICCN was birthed in 2020 when we thought that it was really important that we have a way to integrate understanding the condition, learning about it, and also researching with a small r and a capital R in a very human way to try and understand and help people. And so when I look at the exhibition and I see people's stories, I think it brings to light how important it is for us to maintain humanness, even when we have diseases that we don't understand. And so what we've tried to do is integrate learning, education, and continue to help people with this condition. And I think there are many, many people, nurses, occupational therapists, physiotherapists, physicians, dietitians, psychologists, pharmacists, and most importantly, the people living with the condition, so that they can help us understand where they're going and how we can best help and learn with them and for them. And so this exhibition, I think, is really testimony to the fact that if we listen and learn, as you said, and as Elder Sam said, then we tell our stories, and through our storytelling, we learn more, and then we can actually take this forward. So I'm really proud of all the people that have worked so hard with and for people living with long COVID, so that we understand this and that we can make a difference, not just now, but going forward. So really, when you walk around and you see the stories, I hope that it brings you the human side, and that the medicine and the learnings from this condition, whilst we don't have cures, I think there are lots of learnings, and they are being put forward. BC remains dedicated to supporting education, care, and work, and understanding it better. So thank you very much for all of your support and in seeing this exhibition. Thank you.
Thank you. I would now like to call up Kaylee Jameson, a member of the research and exhibition team, to take the microphone.
Hello, everyone. I'm so thankful to be here celebrating the launch of our exhibit with hopes it will reach thousands of visitors and raising awareness of long COVID. I've had my own roller coaster journey with long COVID for almost 4 years now, but I'm grateful to manage symptoms, be able to work on research projects to advance knowledge and awareness. As a person with long COVID and a science communicator, I tend to talk about long COVID everywhere I go. Uber rides, conferences, social events, and through these interactions, many people still have one, never heard of the condition before, two, hold misconceptions or vague misunderstandings of it, or three, have it themselves and didn't realize there was a name for it. These small examples indicate the broad ramifications from systemic lack of awareness of long COVID. And indeed, in our early research findings, people with long COVID and their caregivers shared that the lack of public awareness of the condition on a systems level is harming them. As long haulers, we often take up the helm of trying to communicate what a condition is and what living with it is truly like. Long COVID, is that a real condition or are you just lazy? It's just some fatigue, right? We tried taking vitamin C or doing yoga. But doing this repeatedly with our family, friends, and even healthcare providers who may still not truly understand or believe us is exhausting and poses real consequences to our valuable and limited energy. We can share research, statistics, and words, but perhaps what may truly lend impact are personal stories and visuals. A picture indeed holds 1,000 words and can convey our daily realities and a profound isolation many of us with long COVID have felt. Over the years, more people with long COVID have found each other online and connected in social media spaces, or even within group virtual healthcare appointments. These virtual spaces are deeply valuable and help us share information, tips, and find community amidst our isolation and lost relationships. It distributes connections that Long COVID Awareness Day was initiated, recognized annually on March 15th. This year, thanks to Nicole Rogers and Acadian COVID Society, long haulers submitted testimonies which were written out in pillowcases, which were displayed on the steps of Vancouver Art Gallery. We have a few of these featured at the exhibit to commemorate community advocacy. While much of this connection and community building mostly occurs online, due to our symptoms and our housebound states, it's validating to witness these often hidden realities brought to attention at a public-facing museum and exhibit for the world to see. When Rakib Tesfaye and Kaylee Byers first conceptualized this exhibit project, I was over the moon. It means so incredibly much to community to have long COVID recognized in such a public and intentional way by an institution. I hope this recognition can help break through the stigma, myths, and silence around long COVID. Long COVID must be recognized for the public health crisis that it is. As COVID continues to circulate year-round, our numbers grow every day. We must break through the apathy and stigma of discussing COVID. While many do not perceive themselves to be at risk, long COVID can happen to adults and children of all ages. In these exhibit photos you will see, it could be your mother, your neighbor, your best friend, your grocery store clerk, and me. To help people with long COVID, please believe us, break chains of COVID transmission, help us advocate, and donate to fund research for treatments. Over our studies, we consistently hear from long haulers that intentional investments must be made in improving access to care, funding specialized clinics, and informing others about long COVID. Listen to people living these conditions, because preventing long COVID and ME/CFS is far easier than living with it. Thank you so much, my research colleagues, our long COVID advisory group, PCI-CCN, and funding partners for making this exhibit a reality.
And I'd now like to welcome Catherine Baldwin, a member of our community advisory, to this microphone. And Catherine, I'll just hand you the mic as well.
This week marks my 5-year anniversary of diagnosis with myalgic encephalomyelitis, or chronic fatigue syndrome. In October 2020, news outlets were first reporting stories of people with lasting symptoms after COVID infections, and long COVID didn't become an official medical diagnosis for another 6 to 12 months. The early days of my illness were horrendous. My pain was so bad that it was all-consuming. Nausea meant that it took an hour to eat a bowl of cereal. Brain fog made it so that I couldn't read. I was completely exhausted, yet I couldn't sleep. I tracked the stars across the night sky and knew which birds would sing at daybreak. After diagnosis and learning there was no cure, I felt helpless and hopeless. My chances of returning to my active outdoor lifestyle and rich academic life were slim. One of the scariest things I could imagine was needing a wheelchair. In the past 5.5 years, I've seen 22 medical doctors and 34 allied health professionals. My extended health insurance has covered more than $75,000 worth of treatments. In addition to that, I've lost approximately $200,000 in potential income. Long COVID has a huge impact on our healthcare system and our economy. Today, I've learned to manage my symptoms. I'm still disabled, but I'm no longer suffering. I've processed my grief, my wheelchair gives me freedom, and I've become an advocate. I hoped to design museum exhibits after I finished university, but long COVID closed that path. Being invited to be part of the community advisory group for this exhibit helped bring that dream to life. I hope I speak for the entire community advisory group when I thank Kaylee and the rest of the team at SFU, as well as the staff at the Museum of Vancouver, for making this a meaningful experience. Helping to curate this exhibit showed me that many of my struggles and successes over the past 5.5 years are shared amongst long haulers. Many of us struggle to access medical care, and we turn to alternative treatments for help. Grief can hurt as bad as any physical pain. Moments of joy can be a balm for difficult times. And perhaps, unsurprisingly, pets bring needed joy and connection. I had been on the fence about adopting a pet, but after seeing photos people had submitted of their cats and dogs, I made the decision to adopt my goofy, cuddly cat, Olaf. I see myself represented in this exhibit, and I hope others with long COVID do too. Thank you.
Thank you for that. And I would now like to welcome Dr. Rakib Tesfaye, Knowledge Mobilization Lead and Senior Scientist at the Faculty of Health Sciences at SFU.
Hello, everyone. I want to thank everyone here in person and online for joining us at this launch to celebrate those who made this possible. In 2023, I had extreme pleasure of being invited to join a long COVID research project at Simon Fraser University, which was led by co-organizers of this very exhibition, the brilliant Dr. Kaylee Byers at the back there. And of course, you've just heard from Kaylee Jameson. What emerged from this research after a series of community discussions with patients, carers, and clinicians was one emphatic message: increase the awareness of long COVID. It was a top priority for the daily realities of people living with long COVID, the experiences of millions here in Canada, that these experiences need to be acknowledged and they should not be invisible, that they need to be seen. And we heard you. And so we turned to photography as a way to invite the long hauler community to claim their own narratives and to share their day-to-day realities through their own lens, their own voice. What started as a small pilot that exhibited just 5 photos during a long COVID community event in Vancouver last spring that was moderated by the Pulitzer Prize-winning science journalist and ally Ed Young, has now in less than a year, and I just want to emphasize this, in less than a year, has turned into the Living with Long COVID exhibition here at the Museum of Vancouver with over 240 photos. This incredible feat is truly a testament to the long COVID community whose generosity, guidance, and mobilization made this possible. There are truly no words that I think that could do justice to express the gratitude to everyone who shared and trusted us with their stories. Thank you. Many of you are here with us today and online. In fact, we met a few folks who traveled all the way from Ontario to be here. We want to celebrate you. We also know that we've had participants reach out and say that they're unable to make it due to their exacerbating symptoms and their debilitating condition, and have sent family and friends to represent them. So we welcome you. While others have reached out to us, saying that they had a duty to share their experience, but being here would be too triggering. So we want to thank you for your courage. Us being here today also speaks to what is possible when you listen to community and when you co-create by breaking silos and building collaborative bridges between academia, the arts, healthcare, and community. I am so proud to be a part of this diverse team that has been grounded in respect, humility, a deep sense of responsibility and care. I want to thank the Museum of Vancouver team and particularly the incredible leadership of Dr. Vivienne Gosselin, who championed this project from the beginning and included us in every single decision. This team integrated the feedback with such sensitivity, intentionality, and understanding. Thank you. To our Simon Fraser University team, Dr. Kaylee Byers, you are an inspiration to me. She has been a partner with me navigating all the institutional barriers that we had to jump through to get here, and some late night calls and frantic emails, including one about an hour ago, so thank you. To Kaylee, it has been an extreme pleasure watching you grow as a leader. I've learned so much from you, so thank you. You are truly, truly a brilliant leader and researcher. Rhian Hare, this would not be possible without your incredible logistics and organization and keeping us on time and on track, so thank you. And Gladys Wee, thank you so much for your constant positivity and communications. I'd like to thank our partners at the PCICCN, Esther Kaur, Dr. Viet Fu, Alia Izquierdo, for your expert guidance and consistent support. Thank you so much. And most importantly, thank you to our community advisory group, Robert DeRosa, Katie McLean, and Catherine Baldwin, of course, for sharing your valuable spoons with us and their rich expertise. This was a really involved process. I just want to emphasize this. And so they were with us at each step of this journey. Lastly, this is a start of a conversation, which we hope will, of course, reduce stigma, foster empathy, and call attention to the urgent need of care and research in long COVID. But in the coming days, weeks, and months, we will be planning more events with the MOV team, including potential workshops for healthcare workers and the general public. So please reach out to us and tell us what you would like to see, how you would like to continue this conversation together, because it doesn't end here. Thank you.
Thank you. And for the final set of remarks, I would just like to really thank everyone here at the MOV team who's helped to make today's event possible, both in person and online. So big thanks to our camera person, Dustin, for getting all the Zoom stuff organized. And thank you for Jasper, our program lead, for getting things set up, and for our amazing visitor service folks for welcoming people into this space. There's so much work that goes on behind the scenes to make an event like this happen. And huge, huge thanks to everyone who's come together to make this possible. To echo the sentiments that were just shared, this is just the start of a conversation. And we really encourage everyone in our community, if you are passionate about this topic, to let people know that this exhibition's here and to spread the word, because the more people that can see the stories, understand the challenges that our people living with long COVID are experiencing, I think the bigger difference we can make in the community around this topic. So thank you all so much. There is food available at the back of the room. You're welcome to stay and mingle in this room. You're also very welcome and encouraged to visit the Living with Long COVID exhibition. And if you need help finding the exhibition, find someone with an MOV name tag and we can show you where it is in the museum. So thank you all so much, and we look forward to continuing this conversation with you.